Hello, everybody. My name is Alex, and this is the 5th episode of our podcast, Reframing Modern Medicine. Our mission is to bring awareness on the evolving treatment choices for the human condition. This episode, we interview Dr. Hyun Lee, a doctor of Oriental medicine and the president of Wongu University of Oriental medicine. This episode, we talk about Oriental medicine and how it can benefit the human body. If you would like to enjoy this podcast with video, please check out our page on Spotify and YouTube. Thanks, and we hope you enjoy.
So today we have the great Dr. Lee, acupuncturist, and a lot of other things that you do, right? Yeah, is this not true? So tell
Appreciate
us.
it.
Yeah, definitely. So tell us a little bit about yourself, your name and everything.
Yes, my name is Hyun Lee from the Wongu University. I serve as the president of the school and clinic. And before I came to the Vegas, I was working at several different clinics in the Los Angeles.
Okay, cool. And how did you get into acupuncture yourself?
Well, originally when I was in the UCLA, the pre-dental students, I was going to pursue the dentistry. Mm-hmm. But after I see the Oriental medicine books and got very inspired, so I changed my career to the acupuncture field.
Okay, I see. So did you receive any of that treatment prior? Did you receive treatment with your family or when you were growing up? Is it a cultural thing for you, or how did you become aware of Oriental medicine and acupuncture?
Well, I also got several acupuncture and then herb treatment back in the South Korea and then the China also. Those practitioners, the treatment and the philosophy was very interested in. Mm-hmm. And when I was in the dental school in the Shanghai for the 2 years, after that I went back to South Korea for the civil service for 2 years. Mm-hmm. During the time, I read the Oriental medicine book, and it was very interesting combining the natural science to the Oriental medical theory. So I called the publishing company and then talked to and joined the author seminar for 2 years. Okay. In addition to it, I was also got inspired by the very humble the acupuncture, the Oriental medical the doctor in the South Korea. Mm-hmm. Very luckily, I was able to join their seminar and get to know about how the integrated medicine can be. So those moments, I was deciding maybe a dental or the Western medicine might be also very great career. But for my personal interest, I want to think about the Oriental medicine more philosophy and then involve myself as the treatment, offering the treatment as a practitioner from the Monday through Friday, 9 a.m. to 6 p.m.
Yeah.
So even though I don't do much on the weekend, just sleeping now as nowadays.
Yeah, absolutely.
I wanted to feel more comfortable and have more satisfaction in my life. That's how I shift my career from the dental to the acupuncture.
Okay. And where are you from?
Originally, I'm from the South Korea.
South Korea.
So I graduated the high school in the Korea and then went to the junior college in the San Diego, transferred to the UCLA, graduated and went to the Shanghai for the dental school for 2 years. After that, serving the military service in the Korea, then I came here.
Okay. Oh, all right. I see. So in your family, are there other doctors or other, I don't know if you have any siblings or anyone like that? Is there anyone in your background in your family, like your father or anyone else that's a doctor or anything like that?
Well, he reminds me 10 years before the conversation with my family.
It's a good conversation, I hope. Yeah.
It was very emotional conversation.
Really? Oh, really? Well, do you mind sharing? Is that okay?
Oh, it's totally fine.
Okay, all right. Yeah. So what happened? What was that conversation like?
Oh, yeah. My father is the dentist in Korea.
Oh, my goodness.
Oh,
I see.
I wanted to pursue more the dental field, and then he's gonna give me the full a very detailed guideline to be the dentist, how to become a successful dentist. So that's how I went to the pre-dental or dental school in the Shanghai. But after I made a decision, that was almost my first time saying no to the parents. Before that, even though there are so many things I couldn't do, but I never say no to what the parents want me to do.
Yeah.
But that was the very first moment that choose the acupuncture and Oriental medicine like a career.
Yeah.
So my parents and surrounding peoples were somewhat like against me.
Yeah.
So, well, it was a little bit it took like several years to fully let them understand and then support my career. And nowadays, my parents and family, my friends, all like support what I'm doing. So I'm very happy with it.
That's great. Congratulations. I'm sure that was quite an interesting conversation because I know culturally, I have friends that are also from Asian descent, and they tell me the same thing, that culturally you pretty much obey and listen to your parents. You don't really go against them. You don't go against the grain, and everyone must pretty much follow in the footsteps that your family's kind of provided or expectations of your family, right? It's pretty accurate. And well, good for you and congratulations, because I'm sure that was very difficult to go against your family, because I know my family's a little different, but however, culturally your family, must have taken it kind of hard, or maybe they disagreed with you or they were very upset maybe for a while.
I was very somewhat secure and then having more the comfortable in the dental field because my father or the other surrounding peoples can give me more the guideline. But after I choose the acupuncture and Oriental medicine, there's no one to ask. So I was searching for more the seminars and several the conference. My home was very next to the expo, the conference, the area.
Okay.
So I visited several the Oriental medicine or the integrative medicine conferences.
Yeah.
And then when I read the book, I also reached out to the author to have more the meeting and further information.
Oh.
And very luckily, I was able to get more the mentors to give me more the guideline how to practice and how to study the Oriental medicine. So I was very lucky to find those the mentors.
Sounds like destiny, right? It was just kind of the universe or whatever religion you may believe in guided you to the people you needed to meet to get to this point, would you say?
Oh, this doctor is very intuitive.
I'm just saying because I can relate to that. I feel the same way as you do. I feel very lucky and fortunate. So you moved here and you came to UCLA. Is that when you first arrived here in the United States?
Oh, I started the college life in the junior college in San Diego, some at the Grossman College, some at the east side of the San Diego. And then 2 years later, I transferred to the UCLA. So I studied the evolution ecological biology for the bachelor's program.
Okay. And then you have a master's, yes?
Oh, so after that, I went to the Shanghai and then the military service, then came back to the Los Angeles. So after that, I start the South Bay Law, the acupuncture school in the Los Angeles in the Korean town, and to start the master program.
Okay.
So I finished the program somewhat a little bit less than 10 years before. Yeah.
Okay. Right. Interesting. Everyone in Korea has to go to military training. Is this true?
Oh, yes.
That's what I heard. That's why BTS, Monte's favorite. So they had to break up because of the military. That's what Monte taught me. I don't know. So it's very interesting.
Okay.
So then you graduated from there, and then you went to, is it Baylor? Is that where you went?
Oh yeah, I went to the South Bay Law, the acupuncture school in the Los Angeles. And after I finished the program, the most important thing is finding a job, isn't it?
Yeah, of course.
And as the international student, I also need to get the green card sponsorship. I went to the several different seminars or the integrated medical conference. Also, very luckily, I was able to meet the boss, who is the psychiatrist, Dr. Robert Chang, in the Insight Choices. So I went to the UCLA Integrated Medical conference, and one very a skinny tall guy was raising his hand, asked a question to the speaker. He was searching for the good acupuncturist, and he doesn't know how to find. I remember that the guest speaker, the speaker on the stage, also doesn't know what to answer. So after that program, after that the conference seminar, when he came out, I approached to him and I gave the business card. I made the business card before I graduate. So I'm not the best acupuncturist, but I'm the most available acupuncturist in front of you. I also do the house calls too.
Oh, do you?
On the next day, he called me. So I went to his house and then offered the acupuncture treatment. And we discussed about in my understanding about the Oriental medicine diagnosis, acupuncture treatment, and possible the herbal treatment too. Then he told me that actually he is the psychiatrist searching for the acupuncturist and then willing to sponsor my green card.
Oh.
So that's how I start working at the psychiatric clinic in the West Hollywood for 5 years.
Oh, that's great.
Psychiatric clinics are hospitals or wards specializing in the treatment of severe mental disorders, including schizophrenia, bipolar disorder, eating disorders, dissociative identity disorder, major depressive disorder, and others.
That sounds wonderful. So then how did you manage to get over here and become the dean of the school?
I was more into this the yin and yang philosophy, or the utilize the five element theory to the practice. But I was more into the musculoskeletal based treatment. That is also great, but it was not my the initial the interests. So I was searching for somewhat the YouTube or other the books in the second hand, and I was able to find somewhat the teaching position in the Los Angeles Acupuncture School and in the Wongu University too.
Mm-hmm.
So I start teaching the somewhat online courses for the some nutrition class or the other classes. And the next quarter I was able to teach the in-person class. So I was flying from the LA to the Vegas back and forth every week. And after that I got some an interview with the administration in the Wongu, and then offered the full-time position on the on-site. And that's how I moved to the Vegas almost 2 years ago.
Oh, great. Congratulations. That sounds great. So a lot of hard work is what it sounds like. You did a lot of, you had to practice, you did a lot of work with a lot of people at home stuff, and that managed to get you here. And now that you're here, now you're going to share with us what is Oriental medicine. So is it Oriental medicine and acupuncture, or Oriental medicine encapsulates that which is acupuncture?
In the main term, the acupuncture and Oriental medicine somewhat separated. But in our the degree name of the degree, Oriental medicine is covering the acupuncture too, so it's somewhat a little bit kind of tricky too.
Right.
Yeah. So the master program is the master of the acupuncture and Oriental medicine.
Okay.
But in the Nevada license, we call it the title is the Oriental medicine doctor, who perform the acupuncture and herbal medicine.
So if I wanted to go to your school, let's just say, I would have to get a master's in acupuncture and then get also the doctorate in Oriental medicine, or can do I just need a master's to do acupuncture?
Just need the masters to do the acupuncture, and then to practice the herbal medicine too.
To practice it, because they work hand in hand essentially.
Yes. So when the patient is next to me, I do the acupuncture, cupping, or the other more the hands-on practice.
Mm-hmm.
But when the patient is away from me, then I practice the herb or other the nutrition suggestion too.
Okay. So what exactly is that then? What is exactly, we'll start with acupuncture. What is exactly acupuncture? How would you describe it to the average person or someone who's never been?
When I encounter those the patient, the first comment is that acupuncture is to reduce the tension on the muscles to reduce the pain level and frequency. Acupuncture needle itself is thinner than hair, so it's not a painful at all. Many people imagine about the syringe in the hospital, but it is almost 10 times, 20 times much thicker than the acupuncture needle itself. So the first thing that I make sure is that acupuncture, the treatment itself, is not painful at all.
Right.
And then the second thing is that by utilizing the acupuncture points, some group of the acupuncture points located on the muscle belly. Some other points are located on the somewhat the insertion or the origin.
The origin of a muscle is an attachment site that connects the muscle to a bone. This point usually doesn't move. The insertion is another attachment site which does move.
To reduce the tension and dilate the blood vessel and make the like a lymphatic circulation much more improved too. So with the acupuncture, the treatment, there's so many different types of the patient, like a shoulder pain or low back pain, but there the common testimony is that they feel more lighter, a little bit more warmer because of some better flow on the local joints.
Yeah. So acupuncture is, from what we watched in videos, as far as, maybe you can correct me if I'm wrong, it's to work with the body to help the energy travel throughout the body anywhere that it may be stuck or maybe not able to get through, which affects your body in a way that creates these symptoms that you're feeling as a patient. Is that true, or?
This doctor is really pinpointing. You're doing the acupuncture.
A needle, right?
That's exactly what I also explained to my patient. I described the acupuncture as the very mean manager.
Mean manager.
So when we operate the business, some group of the staff are working so hard, just like him. But some other group of the staff is somewhat lazy. So with the acupuncture, we make somewhat a balance between the somewhat lazy group to work harder, for the overworking the staff to calm down, to be a little bit more relaxed, to make the balance to each other.
I see. So it sounds very similar to what we do here. I mean, with massage and chiropractic. In my mind, I try to simplify everything and I make it simple. So I imagine the body is running a system and it requires so much energy. So if there's too much going on in one area, as you described, right, too much tension, maybe your quads or maybe your neck or whatever it may be, you then come in and release the tension across it, and that eases the flow of blood, lymphatic system, everything you described. We essentially do the same here, chiropractically speaking, to some extent, but yours is a little different because the patient is completely relaxed, and then the needle essentially does the work, and everything's based on your expertise, clinical skills, and precision as to where these points are. These points are, so they're energy points. Is it the meridian points, right? Or how does it work?
Meridians are strings connecting acupuncture points, which are considered as passageways through which energy flows throughout the body. The meridian system is composed of 12 principal meridians, each of which connects to an organ system.
When I explain the Oriental medicine or the meridian theory to the public, my patients, I simplified as a somewhat group of the muscles that works together.
Okay.
It's not the exact description, but the vertically there's a group of the muscles that working together, isn't it? On the back of the lower back and the back of the thigh also. That belongs to the same meridian. On the front side, lateral side, the each side of the arms or the leg, they're also working in the same way. So by choosing the local area, and then based on this the muscle system and meridian system, we also choose the distal area too. And when we describe about the meridian theory, there's a 12 meridian is running on the body. So we describe as the somewhat 12 freeway in the big map, isn't it?
Yeah.
So in this 12 meridian is also systematically connect to each other. There's one group of the meridian running on the backside that is working against to the group of the one line of the meridian running on the medial and front side of the body. So that is someone working as a bicep and tricep, just like an antagonist relationship. So when I see the low back pain patients, not only I choose the local point on the lower back and then the distal point that belongs to the same meridian, but on the other time, when I see the patient again, I also choose the other group of the acupuncture points that belongs to the antagonist muscle group, the acupuncture points.
to the opposing muscle, essentially. So the front, I mean, some of us may not know what the antagonist, he may not know what antagonist is. So what we're saying is there's a bicep and a tricep. One muscle brings it to do this, the other muscle does to extend. So the antagonist, if we're going to work the tricep, we also want to work, you're saying, the other muscle, which would be the bicep in this example, right?
There's a two group of the relationship of the muscle. One is the best friend. They work together.
Yeah.
Another one is the enemy. They work against each other. So the enemy called the antagonist, best friend called the agonist.
Yeah.
Is it right?
Yeah. No, absolutely. Yeah, no, it's okay. Yeah, agonist, antagonist. But any of them could change at any moment, right? Based on what you're focused on. But yeah, I understand. I just don't want to get too technical because then people are going to be like, what is going on?
Okay.
So acupuncture, who would serve best? Who's the best patient ideally that you see? What is the most common, besides low back, what other issues do you feel? Because if I come in and I treat them for low back issues, right? I know that I'm going to work on them and they're going to feel better generally. Once in a while, I come to the conclusion that the issue is more maybe psychological. They're having some trauma or things of that nature. Does acupuncture help in that respect, or what other things or features or modalities or things does it do to kind of make the person feel better? Is it just the energy? Is it just the meridian points that we're hitting these points and then we're moving forward and the person's like, hey, I feel better? Because I want to know when I want to refer someone to you. So if Alex comes in, he's like, I have back pain, and then I tell them, okay, well, we worked together, I'm not seeing you getting any, you're getting better but not all the way, I'm going to refer you to Dr. Lee. Is that typically how you recommend patients to be referred to you, or is there a specific set of symptoms or indications to you that the patient would be best served by acupuncture?
So the Oriental medicine itself, include acupuncture, is mainly targeting the internal medicine. Even though we are recognized as the like a musculoskeletal like a pain management, but in the more the Asian community, the fundamental is to target the relevant organs to fix. When I was working at the psychiatric for the 5 years, most of my patients are referred from the MFT psychologists or the psychiatrists.
Mm-hmm.
So most of my patients are generally have anxiety, depression, ADHD, and then PTSD too.
Mm.
So when we are encountering those that anxiety level or the secondary insomnia level, mainly what I was doing is do the diagnosis and then eventually to answer my question, which one of the meridian, which one of the organ I need to focus on.
Yeah.
So even though it also can be related to like some of the brain function, but in the Oriental medicine, we want to eventually make the conclusion what kind of like an organ imbalance it will cause the anxiety, depression, or PTSD or the ADHD. So there's a common diagnosis was made for the large group of the patient, but each patients are somewhat different to each other. So based on the Oriental medicine, the diagnosis, and then the treatment, the reaction, I also give another like a consultation regarding the anxiety and depression level. So when I do the follow-up, the acupuncture, and then the herb treatment, check the anxiety level and the secondary insomnia level too. And another the Oriental medicine the theory is the linking the psychological condition to each different organ's dysfunction. Obviously, when we are having like some heart related issue like a palpitation or blood pressure also can be the stomach, more the acid reflux, those things, isn't it? Very common. But in the Oriental medicine, we also groupize the group of the types of the emotions. Like when we are feeling more sad, feeling more scary, feeling more worried, or the feeling more like too much like excitement. We are grouping the patient's emotion to the 5 different groups, and then get to know which organ is relevant to those types of the emotion. So if we are based on those the Oriental medicine, the theory, make a diagnosis, and then prescribe the acupuncture, and then the herbal, the prescription.
So question. So
Yes.
if we just covered before you, we had a family therapist come on. We discussed depression and anxiety. So, in your experience, which organs are most commonly related with those two, um, I guess, issues? Would you say?
When I practiced in the psychiatric clinic, most of the patients are somewhat the combination of the anxiety and depression. But when I checked the pulse, tongue, and some of the additional the diagnosis, I was able to find there's a ratio is different. 6 to 4 anxiety depression or 2 to 8 anxiety and depression is we can also link as more the yang type or the yin type. And then we also can differentiate to the which types of the organ will be more affected in the patient. But my personal, the subjective, the experience is the most common one is that the pericardium, sanjiao, and stomach, spleen, those combination was the most common one.
So you said pericardium. What was the other one?
Pericardium and sanjiao is the two of the 12 organs that we are talking about. But these two organ is generally meaning about the pericardium. It means somewhat the emotional, like a psychological concern in general. Sanjiao is describing thoracic cavity, abdominal cavity, pelvic cavity, the relationship. So the upper, middle, lower jaw is the main terminology we use, but it's very similar to the thoracic, abdominal, and pelvic cavity, the pressure and relationship, and then the balance among these three cavities. And when we are thinking about this, the pericardium and the stomach, they're the mutual connecting the relationship. So the people who has more the anxiety or the depression in general, the very first target is about the pericardium, and then the sanjiao, the exterior interior relationship, and then mutual connecting the point connecting organ is the stomach. So I was first I was checking those the pericardium and sanjiao and the stomach.
Stomach's the next one. Then.
Yes.
So if I came in with rheumatoid arthritis, let's just throw that one out there. If I came in, what is a general consultation and treatment going to look like? Is it initial visit and then like 3 to 6 visits? Is it a month? How does it work?
Usually for the somewhat the younger the generation, I see the somewhat like a month to see the progress. But for more the senior community, I need to expand somewhat the 6 weeks or the 2 months. But during the time, the patient is able to feel some of the difference and changes too.
Okay. Yeah, my mom's received acupuncture. The doctor that would provide care for her was Japanese. He spoke Spanish. He was an interesting guy.
Wow.
And then he used the mantas. I think that's what they're called, the ones that you light up, yeah?
Moxa.
Moxa,
Yes,
sorry.
yes.
Moxa. Wow.
Moxibustion is a form of therapy that entails the burning of mugwort leaves. This is a small spongy herb that is believed to enhance healing with acupuncture.
Oh.
And he moxa. So she would do that he would provide that for my mom, and she had rheumatoid arthritis. That's why I'm asking the question.
Rheumatoid arthritis is an autoimmune disease, which means that your immune system attacks healthy cells in your body by mistake, causing inflammation. Rheumatoid arthritis mainly attacks the joints.
And it really helped her a lot. And she would go, I don't know, once every 2 weeks or so. And she said that was the best, help with her pain and discomfort that she had, because she worked frequently as in housekeeping. And so because of that, bodies, as you know, it's a very difficult job. So you're moving around, you're lifting, you're cleaning, you're doing a lot of repetitive movement sometimes. And so for her, that provided her the most, I would say the most help with her discomfort and RA pains and flare-ups and things like that. So I was just curious, do you guys do that at your office?
In our the Wongu Health Clinic, we also offer the Moxa, the treatment too.
Moxa, yeah.
Especially Japanese style is also very interesting. Since my background is the Korea, but I was also in the China, and then many people also interested in the Japanese style too. So there's a group of the Japanese acupuncture technique and then moxa technique too, and then the Chinese style and Korean style too. So in our end is very different to each other, but the patient's end maybe looks all the same.
Yeah, yeah, we don't know, right? Like I would think because everybody, when we looked it up, what did it say it was? What was the majority of it, Alex?
Oh,
What do you mean,
Like when you looked it up, because I asked him, I go, we're both gonna look at videos about what acupuncture is. What did it say it originated from? Where was it from?
I said that acupuncture originated from China, right?
oh yes, in the textbook, but in my personal opinion is that it was somewhat originated in the throughout the countries. China is the one that puts more effort to make it as a somewhat education
Yeah,
and make more the school and then the practice and then create more organize more the textbook. But when I was studying the Oriental medicine, the terminology classes, I used to teach the OM, the terminology class. For that, I was doing some my homework to create more the slide, isn't it?
yeah.
And then I found that the many of the Oriental medicine, the terminology was also originated from the China, but also originated from the other countries too.
Okay.
So it is somewhat like a mixture of the several different countries throughout the years.
Yeah. Okay. So so going back to like treatments, like we talked about an RA patient or whatever, or someone who maybe has some sort of other issues. I had a patient come in and tell me that they discovered she had some sort of kidney issues, and so you guys provided help. That's how I discovered your office and your practice. But what would you say? Most people, like myself, sometimes a little scared of needles. What do you tell someone like that to kind of ease them? I mean, you've already described it. It's as thin as a hair, doesn't really hurt too much. But is there anything else that you guys suggest or recommend to kind of ease their concerns?
Most of the new patient never had a acupuncture treatment, so I often encounter these questions.
Yeah.
So the very first thing is the acupuncture needle itself is like a thinner than hair. And then second thing is that I ask their help because unlike the surgery, this is not the unidirectional treatment from the provider to the patient only. We also need the cooperation from the patient to the provider. What we need is some group of the patients are very busy during the acupuncture treatment, somewhat doing the work with the cell phone and then calling to the other people. They also do that too. Then, in my opinion, the acupuncture the treatment result may not be very effective. I hope the patients are fully rest and then more focused on this the belly breathing.
Yeah.
And then more the stationary. Imagine this the acupuncture is working through the linear the channel of the meridian. Then the effect is much better. So what I'm explaining to the patient is that it's not the painful the treatment procedure at all. And second thing is that I also ask your the cooperation. Those two things.
Okay, I see. And so then you've already kind of covered some of the things that people, they get the wrong, there's some misconceptions regarding the treatment, big needles, etc. Do you generally offer everyone herbal, like you said? So you come in, someone comes in, we do acupuncture. When they're away, then you give them herbal supplements, from my understanding, and then you give them some homework to do. Is that with every case, or is that just as needed?
As needed, but the most of the cases, we start the liquid extract herbal formula from the last year. We started from the one formula, but because we're not sure whether the Vegas local peoples are willing to accept very different modality. because this is somewhat the espresso style, like a cooking the herb, and then so pressure cook, vacuum seal the liquid formula. And this is the combination of the some several the Chinese single herb. So the taste is very bitter, and some of the patients is describing as drinking the tea, drinking the tree.
Oh, the tree itself, the bark and the...
Yeah, so that's a very exact
Yeah.
description, but that's how they describe about the taste. But it becomes like a very successful. So we launched another and another. Now we're launching almost like a 60 or 70 different the herbal formula. Each one has their own different function. It's not about the, like somewhat the universal, like a good for the general the wellness.
Yeah.
But some group of the formula is very commonly used for the some muscle relaxation, or a little bit more the some better energy, or the some ease the stomach, or for the sleeping quality. There's also some the general formula that we are commonly give to the large group of the patient. However, there's another group of the formula need to be very carefully like diagnosed. So it's very easily get the side effects. So there's some group of the combination of the Chinese herb, very commonly used for the back pain, pain management, or the like a bowel movement, or the intestine function,
Yeah.
or the somewhat ease the sleeping quality. However, there's another group of the formula need to be very specifically like diagnosed, and then very very good match. It has to be like a good match with the specific Oriental medical diagnosis.
I see. So would you recommend acupuncture for every age group, babies all the way to seniors?
Because we also recommend to let them see the Western doctor first for more the diagnosis, and if they're able to offer those the treatment, we also like let them to go. However, if the treatment is not enough, or if they also refer out to the clinic, we are very willing to see those the group of the patients to include like a younger the infant, or the young generation the patients. Recently, I had some patients with either the shoulder pain or the migraine too.
Yeah.
They tried the other like a medication first, and it wasn't helpful for the group of the patient. So I was able to offer the acupuncture the treatment. Some of them I'm waiting for the result, and some of them I got the good results too.
Oh, that's great. Can you talk about maybe one of your cases, one that's been an extreme success that you've had, that maybe, for example, they went to a chiropractor and it didn't help, or they went to a medical doctor and it didn't help, but for whatever reason, Oriental medicine and the herbs and maybe acupuncture and other things that you do help someone?
I have the great the testimony that people got so much benefit from the chiropractor.
No, I have that one too. I know that one. If you go on my Google review, you see them all. But what are the big ones or major ones that you know that have come across, that you've encountered? The ones that you kind of left you like a memory, like that was incredible. I can't believe that such a big change in their life, that switch or that shift in their life happened because of the treatment you guys provide.
The few months before, I was able to see the patient who is with the oxygen tank.
Okay.
And then with the acupuncture treatment, and then the consistent herbal formula. The herbal formula was like generally for the senior. It was very some simple herbal formula.
Yeah.
So the 2-3 months later, she was able to walk without the oxygen tank.
Oh wow.
And then another case is the sciatica. It's very common.
Yeah.
So with the acupuncture and some of the herb formula to reduce the muscle tension, and then although most of my the acupuncture treatment is with the very thin the acupuncture needle, but when I encounter the sciatica, I also use a little bit more thicker and then longer needles to more directly touch the core muscles too. So some group of the patient with the cane, they after the treatment they forgot the canes too. I experienced that several times.
Yeah.
And then the patient on the last week from the Dr. Sintae Kim from who is our the clinic director, and his specialty is the fertility, and he shared the good news that his patient got pregnant.
Oh wow, that's great.
So the Oriental medicine, one of the like a big portion of the specialty is the fertility.
Oh, so the husband and the wife, or is it just the husband or just the wife in that
Wife.
case? For the wife, okay.
Wife, and then I don't know about that case, but he also see that husband and wife together too.
Oh, that's great. So that worked out. That's impressive. What diagnosis do you commonly see that you're able to treat? Like you've already given a few, right? You said like sciatica, what was the other one? Migraines, right? Fertility issues, those are great. Are those generally diagnosed by a medical doctor and then you see it, or do you just find it and realize like, okay, maybe that diagnosis wasn't accurate and in fact it was more of something different?
Oh no, I need to be more careful on the like thinking about the practice scope. So I don't have any the authority to get to know about this reevaluate the Western medical doctor's practice.
All right.
So I'm fully like to understand that all the Western doctors they're doing their best to give them more care for the patients.
Of course.
So when we accept the patients, we check the previous the diagnosis made by the Western doctors.
Yeah.
But in the Oriental medicine, it's a little bit some of the different perspective. That's why we're here. So if we are doing the same thing, then there's no point coming to the clinic, isn't it? We see the body same as the nature as we describe, and then based on the meridian system, we reevaluate, make the Oriental medical diagnosis.
Ah, I see. That's quite interesting. Now, is there a specific diet? I know you give herbal supplements, as you said. Are there other diets or things that you recommend to your patients once they're receiving treatment with you?
So I normally also recommend the herbal formula for somewhat in general first, but that depends on the patient's reaction. I also encounter somewhat the side effect of somewhat the nauseous feeling or the intestine issue. Then I change to the mild one or the detox program. But when I see the patient, because in my understanding, Oriental medicine weakness is the intensity compared to the Western surgery or the other medication. So what I want to do is to give more often influence. When the patient is next to me, I offer the acupuncture cupping or the moksa. When the patient is away from me, instead of waiting for the remaining 6 days, I want to give more the influence through the herb or the nutritions.
Okay.
So even I reduce the dosage for the group of the people who feel somewhat either finance or the taste is too bad, then reduce the dosage or change the format, but still want to give more the influence to change the condition to be more favorable way.
I see. Now, so how does you've talked about needles, we've talked about herbs, now you talked about cupping. How does the cupping actually work? How do you guys use it, and what is actually the foundation, the mechanism as to how it functions?
Because quite many people like the cupping nowadays. What the cupping is the simply opposite of the massage. Massage is somewhat squeeze in, directly disrupt the local soft tissue. Cupping is pulling out to create more the empty space on the deeper tissue level, to reduce the pressure on the deeper tissue, more induce the micro level, the blood vessel, the regeneration, and then better the lymphatic circulation on the local area.
I see.
So it's somewhat opposite to the massage.
So it's decompressing,
Yes.
pulling apart,
Yes.
and then helping to bring more blood supply to that region.
So when we do the cupping, we utilize the acupuncture, the point location first.
Okay. And then what about the moxas? So how do those function? What's the mechanism for that to?
The moxa itself looks like a kind of short cigar, isn't it?
Yeah.
And then the moxa is the dry oak wort, some types of the a herb very looks similar to the cigarette too. And then with the safety panel and attached on the local attached on the skin, so it doesn't burn the skin itself. But the first thing is to increase the temperature, and then second thing is that penetrate the herb oil or the smoke to more penetrate to the local the skin area to induce more the immune system too.
So it essentially is kind of like putting heat or like a hot pack or like a hot blanket over it, but you're using that
That one, and then
oxide.
the herb own characteristic too.
Oh, okay. And so the herb plays a role in it.
Oh,
and
yes.
its effects.
So additional those the two keywords. Yes, in temperature and then the herbs.
Okay, that's very interesting. Anything else, Alex, that you got? Trying to think of. There's a few other things.
Oh, I wanted to ask.
Okay.
What is something that you hear a lot about, like acupuncture or just Oriental medicine in general, that is like wrong?
Wow, such a like a hard worker staff is making very good question. Thank you.
Smart kid.
Yes, it is. In the Nevada, not many people, not only in the Nevada, our the Wongu's the recent our the marketing plan is the outreach plan is to make the Wongu is the only one acupuncture school in the Nevada and surrounding 9 states. So what I was doing for the last few months is the visiting other states, Utah, Kansas, Oklahoma, and then we also target like Idaho or the other locations too. Not many people knows about the Oriental medicine career itself. So the school is also somewhat the professional the school to to provide the master level education to make the licensed practitioner, just like a chiropractor or the dental or the pharmacist too. Get the license and practice their own clinic, isn't it?
Yeah.
But not many people knows about this Oriental medicine, practice the acupuncture, practice the herbal formula. Is also able to be regarded as one of the professional like a licensed degree and a licensed career, open their own clinic or work at the Western clinic just like me before in the psychiatric pain management or the physical therapy. I also used to apply to the hospital in the Atlanta or the Texas too, because there's the acupuncturist position in the big hospitals too.
Oh, that's great.
So not many people knows about we have very wide opening the career, and then and many people also aware about the acupuncture and willing to get the acupuncture and the herbal practice too. But not many students are aware about the career itself.
I see. That answered the question.
Yeah.
A little bit.
And another thing is that many people assume that the Oriental medicine, most of the students will be the Asian.
Yeah.
But we have very low percentage of the Asian, and mostly either the Caucasian or the African American.
Really?
The patients also, mostly the non-Asian patients. So that's one of the misconception.
Okay. So to end it, because I think that's pretty much it, we like our guests to kind of sign us off.
Thank you for listening. This is Reframing Modern Medicine with Alex and Dr. Rivas.
Thank you for listening, and we thank Dr. Lee for coming onto the podcast. Please check out wongu.edu for more information about Wongu University and Dr. Lee. If you would like to check out other episodes of our podcast, please visit our page on Spotify, Apple Podcasts, Amazon Music, and iHeartRadio. This is Alex signing off for Dr. Rivas. Thanks for listening and or watching the 5th episode of Reframing Modern Medicine, and we hope to see you again soon.